those who have actually filled the form, and all of them, they are also attending this session. There will be lucky draw session in which we will be choosing one by me and Dr. Marwa sir to your given address anywhere in India. It will be posted to all of you guys. So I think, sir, we are ready to go and we can start today's session, and we'll take all their queries at the end.
Okay, please go ahead.
These are the objectives that we are having: to provide overview on how to utilize the book effectively, and to enhance this session overall motto, we have also invited with such good marks in their FMG, and we'll also see what they have to say about their preparation, how to revise in less time, how to integrate your notes, right? Everyone is having their own notes. How are you going to integrate this book with your notes? Also, we are going to cover that also. And frequently asked question that we have already covered in this session. So this book, if you are going to see, it is having 4 important section. One of the section is called previous year, previous year question. So previous year question is the biggest section of the book, where you are having more or less around 10 to 12 year of that is already summarized for all of you guys. So if I say 10 years, 10 year में around 20 examination हो चुके हैं, right? So whether it was going to be a one liner, whether it is going to be clinical based, the most older question जो मान लीजिए 13, 14, 15 वाले क्वेश्चन थे, उनको we have actually removed from the 9th edition, because उस तरह के क्वेश्चन अभी पूछे नहीं जाते हैं. They are not asking the one liners, they are not asking कि मलेरिया कैसे होता है, जो पहले पूछे थे मलेरिया कैसे होता था, कौन सी मॉस्किटो से बाइट करने से मलेरिया होता है, राइट? तो इस तरह के क्वेश्चन अभी नहीं पूछे जाते हैं. इट्स ऑल गोइंग टू बी क्लिनिकल. तो वी हैव slowly adopted to the new curriculum, and we have included most newer questions. Apart from that, we also have image based section एक अलग से है, so that आपको कहीं अलग नहीं जाना पड़े. Image based section आप सभी के लिए होगा, where you can actually utilize the textbook to continue to solve and practice your image. Last minute revision, LMR section, if you are going to see here the third one, last minute revision क्या है? बुक के लास्ट में पहले क्या होता था, एक अलग बुकलेट आता था, बट इस बार हमने क्या किया कि बुक के लास्ट में वी हैव गिवन अ सेक्शन दैट इज कॉल्ड LMR, लास्ट मिनट रिवीजन. तो वो सेक्शन क्या करेगा, इट विल गिव यू वन लाइनर, जहां पे सिर्फ आपके FMG के नहीं, नीट पीजी के प्रीवियस ईयर क्वेश्चन भी हमने इंक्लूड किए हैं, बड़े ही स्ट्रेटेजिकली प्लेस किए हैं, सो दैट अगर आप उस चीज को पढ़ोगे तो यू विल बी एबल टू अंडरस्टैंड कि हाँ, इससे इस तरह के क्वेश्चन आए हुए हैं. तो बहुत सारे बच्चों का एक क्वेरी रहता है, सर नीट पीजी का क्वेश्चन करना है क्या, नीट पीजी का क्वेश्चन कैसे करने हैं? तो नीट पीजी का क्वेश्चन करने के लिए डेफिनेटली यू कैन यूटिलाइज द LMR सेक्शन. देन वी ऑल्सो हैव क्लिनिकल बेस्ड क्वेश्चन. तो क्लिनिकल बेस्ड क्वेश्चन का मेन ऑब्जेक्टिव यही है कि आपको क्लिनिकली क्वेश्चन कैसे पूछे जा रहे हैं. जैसे आजकल के क्वेश्चन को देख करके यू कैन नॉट से कि ये क्वेश्चन एनाटॉमी का है या फिजियोलॉजी का है या बायोकेमिस्ट्री का है, यू कैन नॉट से दैट. आजकल के क्वेश्चन देख करके द एग्जामिनर विल स्टार्ट आस्किंग समथिंग एंड वो एंड करेगा किसी और चीज से. तो इसलिए आजकल के को अब हम क्या जो जो आपके इंपॉर्टेंट है विल बी starting, but before that, sir, few words.
My
Hello.
input would
Sir,
only be that as far as preparation is concerned, the first subject to be focused on would be anatomy. And that is one subject that requires a lot of effort, because most of the time what I've seen is that in spite of using the notes, students are not able to solve those questions. And anatomy is like make and break for paper 1, because it's going to be like, I would say, the first hour of the exam is the most critical part of the exam. So my suggestion to you guys would be that there are hardly like 400 plus MCQs of anatomy. Please go through them on a daily basis. Even if you're doing 20, 25 per day, it's okay. I mean, I want you to get that habit and get a feel of, getting those questions. And even if you're not able to solve them, suppose, for example, you find them a little more difficult, then like just go through the exploration part and come back to the question once again. But make it a habit ki, by like, let me say, Diwali, or maybe like add like 7-10 days after Diwali, try to finish the anatomy component. I know anatomy is a very boring subject. It's a very dry subject. You can have 10 excuses, but then, like, what I'm trying to teach you guys is that first hour of the exam is like make and break. So I think it's very critically important that you go through those questions with utmost sincerity. I think all of you are like, brilliant guys. You are able to rule out two options, but between the remaining two options, most guys would be, searching for like what could be the correct one. And what I usually find is that most people in the first year, first hour of the exam itself, they tend to, I would say, mess up with anatomy, with biochemistry, because what people are reading is carbohydrate metabolism in biochemistry. People don't focus on protein and nucleic acid. In anatomy, they do a bit of chota sa embryology, right? 1 page notes of embryology, and they think it is done. They don't focus on neuroanatomy. They don't read the pelvis part. भाई मैं नहीं कह रहा हूँ पूरा pelvis पढ़ना, मैं नहीं कह रहा पूरा abdomen पढ़ना है, but at least go through the questions in a retrospective fashion. एक होता है prospective study, it is a retrospective. FMG Solutions is a book about retrospective study. A person who says, sir, I have not read anatomy in my entire medical school, मुझे anatomy नहीं आती है, क्या मुझे anatomy में 60% स्कोर हो सकता है? Yes, it is very much possible. आप नोट्स करोगे, लेकिन नोट्स में आप होली खेलोगे, क्वेश्चंस विल नॉट बी सॉर्टेड आउट, कुछ छोटे मोटे निकल जाएंगे, बट देन यू गोना फील लाइक 10 out of 2, 10 out of 3 is not going to be your final solution. You need to make like 7 or 8 or maybe 9 correct, because anatomy is rattafication, man. I mean, anatomy is not something that you need to put your logic and analysis like in medicine or in surgery. ये भी differential हो सकता है, ये भी differential हो सकता है. So in my opinion, like anatomy is like, yo man, I'm going to go through it right in the first hour, and I want everybody is listening to the seminar to get 100 marks in paper number 1. That's our main focus. We want to help you to get to that figure of paper 1. I speak to so many students. They tell me, sir, paper 1 was very easy, and they get stuck at that 75-80. By 75-80 is not sufficient. You need to pump it up. You have to pump it up from 80 to 100. And believe me, pump it up from the 80 to 100 takes a lot of your guts. It takes a lot of your stamina. And FMG Solutions retrospective is the way of studying. I repeat that again for those of you joining in late. There are two ways of studying: prospective and retrospective. एक है पूरा anatomy पढ़ो, फिर उसके बाद उसके questions करो. Not possible, man. It's such a vast course. So my suggestion to you would be go retrospective. Pick up pelvis today. आपने anatomy कभी भी जिंदगी में नहीं पढ़ी, मैं कहता हूँ फर्क नहीं पड़ता यार. At least आप उसमें retrospective analysis तो करो, तो आपको खुद ही समझ में आ जाएगा कि जब questions आते हैं ना, he'll ask you, guy went to a bar, he had 2-3 drinks, and then he had a fight with somebody, and this guy, the other guy picked he kicked him in the abdomen, uska urinary bladder burst kar gaya. So you're going to be having extraperitoneal rupture, you could be having an intraperitoneal rupture of the urinary bladder, or they could be like, the guy was kicked in the groin, or the guy was kicked in the private parts, and then there's blood at the meatus. So they're going to put up questions which are like typical urethral injury. Nobody reads rectum, anal canal, urethra, pelvis very thoroughly. So I think if you pick up the book and if you go through anatomy section, it's going to be beneficial for you guys. These were my inputs. I hope the audio part was very clear. And I think Dr. Siraj, you can take over at this moment in case you want to. Otherwise, I'll move on to the biochemistry section. But yeah, anatomy is something which I want you guys to be rock solid with. And I think those 400 plus questions would give you the necessary firepower. Don't think that they're 400 MCQs. They're 400 into 4, 1600 bits of anatomy filtered for you. The core crisp data that basically is required. So I mean, I know you have a lot of sources. आप बोलो यार मैं 1000 क्वेश्चन कर लूँ anatomy के, possible ही नहीं. I am saying try to do 20 every day for next 20 days. At the end of the day, 1 घंटे में 20 करो. But then a big chunk of anatomy is off your shoulder. I mean, get that, those monsters off your back. I mean, psychiatry, I know you brilliant chaps kar loge. Psychiatry, anesthesia, chota mota subject, you are anyway gonna cook them, right? You're gonna fry them. So you are brilliant bachas, brilliant guys. You'll cook those subjects. But क्या स्कोर कहाँ खराब होता है? That is anatomy, then is pharmacology, then is patho सब पढ़ते हैं. क्योंकि पैथो पढ़ना सबको इंटरेस्टिंग लगता है, राइट? वो मैडम पढ़ाती इतने अच्छे से निमोनिक से, राइट? एवरीबडी इज लाइक, यो मैन, आई एम गोना रीड एन पैथोलॉजी। तो एवरीबडी इज गुड एट पैथो, बट पैथो से क्या है कि स्टिल एक लॉ ऑफ एवरेज होता है। 20 में से 25 मार्क्स थोड़ी ना लेकर आ जाओगे। मैं कहता हूँ पैथो पूरा सही करके आ गए, 20 में से 20 आ गए, 20 से 25 तो नहीं हो सकते ना। सो यू नीड टू गेट एन एवरेज फॉर एवरी सब्जेक्ट। दीज आर द इनपुट्स फ्रॉम माई साइड। सो डॉक्टर सिराज, इफ यू आर देयर इन द मीटिंग, आई थिंक यू कैन टेक ओवर फ्रॉम दिस। एंड हाई फैजान, गुड टू हियर फ्रॉम यू।
Thank you, sir.
Yes, hi sir. I hope
Dr. Suraj, if you can switch to a alternative a network, that would really be great, because I think you are in a hospital, and because of that, your mobile network is faltering. So we are having a big time lag.
सिचुएशन आज का काफी
Okay, so Dr. Siraj, I think you can move on to a different network in the hospital, and meanwhile, I can continue with the biochemistry component. You see, biochem again. What I find is carbohydrate metabolism, Gaucher's disease, Van Gierke. Absolutely, absolutely. I mean, Manjushri, you gave in a very good comment. I mean, psychiatry is like half a day, so you can cook it, right? But okay. Uh, Fine, I'll continue. So as far as biochemistry is concerned, what I would suggest for you guys is go retrospective. As far as biochem is concerned, don't focus exclusively on your, I would say, the carb metabolism. What you need to focus on is go retrospective again. There are hardly 200 plus MCQs, but if you go through them, you'll analyze. They love asking about nucleic acid metabolism. They love asking about protein metabolism. So a lot of people are not able to go through those sections, because I would say like this: Gaucher's disease, everybody knows, crumpled tissue paper cytoplasm.
Your
No big deal.
content.
But as far as the remaining ones are concerned, it's a bit of a challenge. So just give me a sec, please. वो तो करना पड़ेगा ना, ठीक है, ओके। अभी बैकग्राउंड में हो रहा है।
क्या कर रही है?
हाँ, तो उनको लगे रहो उसमें उसमें Okay. So going ahead with the biochemistry component, I think what I have found is amino acids, just reading glycine is like one of the simplest amino acid, doesn't do the trick. And only phenylketonuria, like most guys, what I've seen is they read only phenylketonuria only partly. They love to ask about the various types of phenylketonuria. So go through all the 4 varieties. Yes, guys, there are 4 types of phenylketonuria. And let me take up alkaptonuria, right? They're not only going to ask you about that homogenesic acid oxidase thing, and they're not only going to ask you about the black urine part, but they are also going to ask you regarding the involvement of the vertebra in that condition, which results in difficulty in mobilization. It contributes to a lot of back pain in the chap. And therefore, a lot of these questions of alkaptonuria will begin with back pain because there's so many differentials of that. So, I mean, when you read tyrosinemia, when you read phenylketonuria, when you read isovaleric acidemia, all those inborn errors of metabolism, they are the ones from which you should focus your start of biochemistry from, instead of like trying from vitamins. क्योंकि वो मजाक है यार, मतलब तुम you guys are brilliant chaps यार, मतलब तुम्हें लगता है कि तुम विटामिन B6 और B1 deficiency causes beriberi and B6 deficiency causes peripheral neuropathy. Matlab, you guys will not be able to answer. I mean, come on, right? So vitamins is like what I do in the end. I always say like this, take the bull by the horns. I always say eat the frog. I always say things like this because I've done it myself, man. When I was in medical school like you, I used to focus on these core things because I soon realized कि भाई इनसे नहीं बनने वाली बात. तो फर्स्ट आई थॉट ये ना मैंने भी ये सोचा कि यार इजी इजी कर लेते, बट देन आई रियलाइज कि भाई बन ही नहीं रही है बात ना, तो आई नीड टू फोकस. हम पढ़ते हैं ग्लाइकोलाइसिस, हम पढ़ते हैं ग्लूकोनियोजेनेसिस, राइट, वी रीड अ कपल ऑफ कॉमन एंजाइम्स, सवाल ही नहीं पूछता वो. We read things, no, what is the enzyme which is common between the two cycles? But in the end, what matters is like your persistence, your dedication, your ability to do questions on a regular basis. So that would be my suggestion. I mean, start today from PKU, but then move on to isovaleric acidemia, move on to reading about tyrosinemia. I mean, थोड़ा effort उसमें अगर आप डालोगे cystinuria, cystinosis के differences, because the technical differences between them that he tends to put up in the question. And okay, let me just put up a question before you, and I would like you to comment in the chat box. Question is your favorite, right? Vitamins. So, which vitamin would be useful for patient with methyl alcohol poisoning? Can I have like this guy? He's an alcoholic, right? So he went to this area where cheap alcohol was available, and he had consumption of industrial alcohol, that is spirit, that is methyl alcohol. And because of this methyl alcohol poisoning, this chap has actually become unconscious. He can possibly become blind as well. So which vitamin is used for management of methyl alcohol poisoning? I'm getting answers like thiamine, which is not the correct answer. Not the correct answer, guys. I'm not asking you regarding beriberi. See, that is the mistake that most people are doing. I'm not getting answer as vitamin B12 as well. Okay, I give you options: B1, B3, B6, and B9 and B12. The vitamin that would be useful for management of this patient. And come on, man, you can't make this mistake. For methyl alcohol poisoning, you need to use two Fs, that is fomepizole and folic acid. I mean, this is bread and butter for you. Lots of time when we read alcoholic, we straight away answer thiamine. That is usually not asked in the exam. What they basically ask you is like whether you've read the data. Some people have answered vitamin B12, but B12 is answer for those cases where there is going to be cyanide poisoning. So again, a question in the exam said, which vitamin would be useful for a patient who's having cyanide poisoning? That is where your answer would be given as vitamin B12. And okay, let me know what is the antidote for cyanide poisoning, by the way. Cyanide poisoning acts by blocking that enzyme in the mitochondria, cytochrome oxidase C. They've asked that in your paper. So I think all of you know that cyanide poisoning contributes to generation of I mean, free radicals, and that can cause damage to mitochondria. I've had one answer that is amyl nitrate, which is not correct because amyl nitrate inhalation. आप सोचो the guy is dying and आप बोल रहे हो inhale amyl nitrate. Do you think that he'll be able to inhale amyl nitrate? No, guys, it's not hydroxy. I mean, hydroxycobalamin is used. Actually, the main antidote. This is given so many times in the exam, but this is not taught in coaching in detail, and that is why I find people faltering. But this is given in FMG solutions. Exactly. Rajvardhan Singh was the first one to get this spot on. It is sodium thiosulfate. And in the option, sodium nitroprusside was also there. It is not sodium nitroprusside, it is sodium thiosulfate. And along with that, hydroxycobalamin, that is vitamin B12 is given. So guys, please focus, right? I mean, questions are not what they look to be. I mean, I asked like very straightforward questions to you, and you can see that all this data is given in FMG Solutions book. It's not that we are boasting about the book. What I'm trying to say is, when in a coaching, what they're doing is like they're trying to complete the course in 2 hours, 3 hours. One teacher will get 2, 3 hours of a subject to be taught, or like he might be completing the subjects in one day. So होता क्या है कि because what that teaching is fast. So we tend to like, neglect those core points. समझ रहे हो मेरी बात को? Like, there are 25 points a teacher has to tell you in like 2 hours or one. So he'll go like maybe slow in five, but the remaining 20 will go a little faster. So when you go through those 25 points, some points are bound to evaporate from your mind. जैसे वो data evaporate हो जाता है. So that is what happens, and therefore people tend to mess up on easy questions. Like the questions that I asked you were very easy. They have a bit of like toxicology overlap, a bit of biochemistry overlap because they want to know about the cycles component as well. So in my suggestion, I'll repeat this once again. As far as anatomy is concerned, start from abdomen. In abdomen, don't start from, stomach and esophagus. Start retrograde. Do MCQs of anal canal, rectum. Read about Houston valves. Read about the features of colon versus the small intestine. Read about pelvis. Do abdomen first, then do head and neck. Again, questions from head and neck. They make or break. I'm taking it easy on you guys. Then do embryology and neuroanatomy. That should be the sequence from my perspective. Neuroanatomy has to be super strong. I know neurology is something that will always trouble every doctor. Even today, it's a nightmare for me. I am not a very big fan of, at any point of time, this medical field, I would say. But I honestly speaking, I am an accidental doctor. But then at the same time, my suggestion to you guys would be to focus on these four aspects. And from the biochemistry perspective, the most important thing would be protein metabolism, all those inborn errors of metabolism that I mentioned. Then go on for nucleic acid metabolism, and in the last, do carbohydrate metabolism and vitamins. That would be my input. Dr. Siraj, could you just put up the slides on, and that would make it a little more easier for you? Or if you can just send the slides to Mukesh, and Mukesh can then just keep on posting the slides if you are hearing. And meanwhile, I'll start with the physiology component otherwise. Give me a second, guys. Just trying to fix that PPT part. I think that was all over the screen, so I just need to fix it.
The audio is better now.
Hanji, Hanji. Yeah, Dr. Siraj, can you just post that PPT, share the PPT? It was all jumbled up. The connection is much better. And
Yes, yes.
let Mukesh and if you can please let Mukesh share that PPT. Can you send it across to
Yes,
him?
I have already shared the PPT to Mukesh and also to Dr. Faizan.
Okay, so it can be shown on the screen meanwhile while I'm doing the talking part.
Yes,
Thank you.
yes, sir.
Okay, I'll just pick up a couple of random questions that came up in the chat. Okay. Yeah, Dr. Manjushri, you're right. Like all those pathways, no, like there is no point of trying to remember those pathways. Honestly speaking, you cannot remember any one of them right till the end when all the 19 subjects would be coming. So my suggestion to you would be that you need to make those small chits. And in those small chits, only the core part of the some part of the critical part of the cycle is the only one that you need to remember. Like for example, when you read about glycolysis, they'll ask you simple questions, how many ATP is being generated. So I don't think so that it will create too much of pressure in your mind. As far as glycolysis, gluconeogenesis is concerned, they are like piece of cake, and they can be solved very easily. Honestly speaking, they don't. This is not a biology exam, so they don't ask you those steps of the cycle like they would do in a NEET UG. They ask you clinically oriented domain with respect to all the disorders that we read about in medical science. So biochemistry is more from the perspective of like the clinical domain. And that's what I would like to say. And GT marks are not increasing. कहते हैं फल की चिंता मत करो, कर्म करे जाओ. So GT marks will gradually increase. This is a part and parcel of our life, that we always are able to push ourselves towards the end. I'll just give an example. Today, I was reading an article about the Chief Minister of Jammu and Kashmir, Omar Abdullah. Yeah, he said that he was able to run only 13-kilometer daily, like, on his practice. And today, he completed a 21-kilometer marathon in 2 hours. Commendable, no? 13 kilometer where it is 21 kilometers. So sometimes, that rush of the exam, right? I mean, that's an inspiration, man, to do 21-kilometer running in 2 hours. So what I want you to understand is that, okay, please make it full screen. Please make it full screen. How do you effectively, yes, that's what I'm trying to say. So time आएगा और आपका GT score increase हो जाएगा. Now the query is how to use the GT. Uh, all questions that go wrong, there can be two possibilities. Na? One possibility बच्चे can be that आता नहीं है. Second possibility is आता हुआ गलत हो गया. So if you know something और आता हुआ गलत हो गया, that is red flag. So I am gonna like write it down in a copy. The 20th copy क्या होती है? 20th copy is all the mistakes that you have done in the entire 3 months. Suppose I'm doing 20, I am revising 20 questions from the GT today. That is what I'm trying to say, man. How to do a proper test analysis. There are two questions that would go wrong. एक है आता नहीं है और एक है कि आता हुआ गलत हो गया. The one that, you know, if you say I did not know this, that's perfectly okay. Medical science is so vast. Even today, I don't know so many topics, so many questions of mine go wrong. I'll not bother about that. I'll keep on gradually building myself. So if there's a new topic, I'll write down the name of the topic and I'll try to read that up from notes or from YouTube or somewhere, or yeah, try to update my knowledge. But most of you are making silly mistakes where you know a topic and you still mess up with an answer. And those are the questions which are basically to be minimized. So in 20th book, every question that goes wrong, summarize it in one single page towards the end, and I think that would be a good way forward. I think that's the way to handle the that's the way to how to analyze your GT questions. Okay, guys, I think we can move ahead in our PPT, and Dr. Siraj and Dr. Faizan, you can continue for next couple of minutes. In case your network falters, let me know. Thank you.
All
Guys,
right.
I'll come up with physiology
Yes,
again.
yes. Faizan, can I have the next slide, please? Okay, sir, these are some of the important frequently asked questions by the students when we ask them to fill the form. One of the question was, how can we make the most of 9th edition FMGE solution, especially for those who haven't used it thoroughly in their preparation. Now, as sir was saying in his talk, that FMGE solution is basically a previous year question. It's a retrospective, way of preparing your examination. Because when you look at any of the examination, we have to first find out that how many PYQs are going to be asked. Let's say NEET PG or FMG or any of the examination. In most of the examination, what we see, the topics are going to be same. The only thing that is changing is actually going to be the way of asking question. Topics, for example, as sir was saying about phenylketonuria, or let's say I'll talk about my subject, alcohol. So in one of the examination, examiner asked that a patient went and bought alcohol from a local liquor shop, and he presented with the poisoning. Which of the following will be the antidote? So the answer to that question was fomepizole. But in upcoming examination, this question can be the same. Let's say the patient is there in PHC where no other drug is available and fomepizole is not in the option. So the next best choice for you would be none other than ethyl alcohol. So see, the same topic, methyl alcohol, methanol पे क्वेश्चन है, और आपको देना क्या है मेथनॉल वाले क्वेश्चन पे, आपको सवाल पे आपका जो सवाल आएगा वो ऐसे रहेगा कि अब क्या दोगे, मेथनॉल में फॉर्मेपिजोल अवेलेबल नहीं है, what else are you going to do? So you have to actually go ahead and you have to actually check it out कि जो previous year topic है वो हमारा कितना अच्छे से prepared है. If the previous year topic is prepared, rest assured that you are going to excel good in the examination. I think we can take the next question. Fazan?
Yes, thank you.
Please switch to yes.
Yeah, so the next question is going to be, what high-yield strategies should we adopt in the 2 months leading up to the exam?
Consider if you are June 2025.
Dr. Siraj, your network is dropping, so if you can switch off your camera, maybe you can conserve some bandwidth. Fizan, you can continue.
Okay. Thank you, sir. So yeah, and additionally, what should we consider if we are June 25 aspirants? So like especially for the December aspirants, I think as Dr. Marwa sir has said already, that retrospective approach can be the best to solve the MCQs and to prepare for this exam. One should understand this exam very thoroughly, that 30 to 40 questions are going to be a bouncer for you guys. I mean, no one Even a topper would be not able to make those 30 to 40 questions. Now the game comes to the especially 150 questions which are going to be frequently asked from the previous year topics, and that's where we need to focus. Now how FMG solution will play its role into your preparation. As far as FMG solution book is concerned, it's not all about the previous year question, but we have other sections as well, like CBQ and LMR section. So you need to utilize it very wisely. Actually, first, what was actually my strategy when I was a FMG student, I used to do questions from the FMG solution before the lecture. So I used to analyze like how much I know, before going to sit in the actual class. So let's suppose right now I'm getting 5 out of 10. Okay, so my score is 50% at that time. So I need to be sure myself that once I'm sitting into the class, now the next time when I'm going to approach the same question, I don't make the same mistakes. So that's how when I was doing the question again, and it was all the revising, the book I am revising again. So the second time I'm taking the less time and I'm getting the more correct answer from the same previous year questions. And that should be the key strategy for you guys to clear this exam. And especially if you are considering June 25, now you guys have ample of time. Okay, for you guys, I would recommend especially to solve 3 years NEET PG and INI set exam questions as well, because many times we have seen that those questions are repeated in the same manner. I mean, when I'm saying that the same, it was actually the same. Even in my exam, there was a question which came directly from the INI set, that the same with the same language and the same options. So
यार उसका रीजन ये है ना कि मैं बता रहा हूँ, बेसिकली होता क्या है कि जब आप एग्जामिनर के माइंडसेट को समझते हो, योर एग्जामिनर फॉर नीट पीजी INI CT FMG, दे आर ऑलमोस्ट सेम एग्जामिनर, द टीम इज एक्चुअली सेम. तो जो एग्जामिनर आपका पेपर बना रहे होते हैं, दे आर वेरी सीनियर पीपल, दे आर प्रोफेसर, दोज आर हैविंग एक्सपीरियंस ऑफ 30-40 ईयर्स. तो उनके यहाँ से जो क्वेश्चन आता है ना, ऑलमोस्ट सेम टॉपिक से डिफरेंट डिफरेंट थोड़ा बहुत ऑल्टरेशन करके, कभी नॉट को एक्सेप्ट कर देंगे, एक्सेप्ट को हटा करके दे विल बी आस्किंग. तो इसीलिए बोला जाता है व्हाट इज इंपॉर्टेंट इज एक्चुअली द टॉपिक एंड नॉट द क्वेश्चन पर से. मतलब अगर कोई ये बोलता है आपको ये क्वेश्चन पढ़ लो और ये क्वेश्चन एग्जैक्टली एग्जामिनेशन में आ जाएगा, तो वो बात उतनी ही झूठी है जितना कि ये बोलना कि सूरज आज पूरब से निकल के आएगा, राइट. तो उन सब बातों पे यकीन नहीं करना है, बट हाँ, प्रीवियस ईयर टॉपिक को जानना इतना ही जरूरी है जितना कि आपके लिए, है ना, सोना जरूरी है या उठना जरूरी है. तो आई वुड से इट्स अल्टीमेट इंपॉर्टेंस फॉर यू टू नो. नाउ कमिंग बैक डायरेक्टली टू टॉपिक कि आपका 2 महीने में स्ट्रैटेजी क्या होगा. देखिए, मैं बार बार बोलता हूँ कि अपने नोट्स के साथ इसको इंटीग्रेट करिए. नोट्स के साथ बुक को कैसे इंटीग्रेट करेंगे, आई विल टेल यू. नोट्स पढ़िए, नोट्स पढ़ने के बाद से लेट्स से यू आर स्टडिंग हार्ट फेलियर फ्रॉम मेडिसिन और हार्ट फेलियर फ्रॉम फार्माकोलॉजी और विच एवर सब्जेक्ट. तो जो सब्जेक्ट आपने अभी पढ़ाई किया उस सब्जेक्ट का MCQs करना आप इमीडिएटली शुरू करिए, सो दैट यू कैन नो दैट द टॉपिक दैट यू हैव रेड उससे क्वेश्चन आते हैं कि नहीं आते हैं. पॉइंट नंबर 1. पॉइंट नंबर 2, अगर आते हैं तो कैसे आते हैं, क्या आप उस नॉलेज को अप्लाई कर पा रहे हो अपने अपने इंफॉर्मेशन में, अपने नॉलेज में, अपने जो भी अपने क्वेश्चन थियरी सॉल्व किया उसके क्वेश्चन सॉल्व हो पा रहे हैं कि नहीं हो पा रहे. तो सबसे पहली बात थियरी स्टार्ट करिए. थियरी में यू कैन स्टार्ट लेट्स से रैपिड रिवीजन, बिकॉज गिवन द टाइम दैट यू हैव, रैपिड रिवीजन के साथ प्रोसीड करिए और इमीडिएटली आप प्रीवियस ईयर क्वेश्चन करना शुरू करिए जो भी बुक में दिए गए हैं. उसके अलावा जब आप क्वेश्चन पढ़े ना, तो अपने आप को सोचो कि मैं सीनियर हूँ और मुझे अपने जूनियर का टेस्ट लेना है, तो हाउ विल आई टेक द टेस्ट, इससे किस तरह का क्वेश्चन बन सकता है. तो ट्राई टू एक्ट लाइक दैट एंड आई एम प्रीटी श्योर यू विल बी एबल टू कम अप विद द नेक्स्ट टाइप ऑफ next language of the question that could be possibly be there in your examination. ठीक है. अगला क्वेश्चन है, what specific approach using PYQs in the 9th edition can help us upgrade our score. तो आई थिंक ये भी एक सेम काइंड ऑफ क्वेश्चन है, सारे बच्चों का सेम तरह के क्वेश्चन है कि स्पेसिफिक अप्रोच PYQ के लिए यही होगा कि जब भी आप थियरी पढ़ते हैं, थियरी के बाद से आप MCQ पे इमीडिएटली जाइए, देखिए कि उस टॉपिक पे क्वेश्चन आया है कि नहीं आया. ये सिंपल सा तरीका है आपके स्कोर को अपग्रेड करने का. PYQs सब लोग बोलेंगे, कोई भी टीचर PYQs रादर PYTs सारे टीचर्स बोलेंगे, सारे आपके जो भी
चलो
आपके
यहाँ पे
मेंटर
सबसे
हैं।
क्वेश्चन पूछ लेते हैं सबसे, ठीक है।
सर
सो यस गाइस, क्विकली कमेंट करना है। क्वेश्चन जो है दैट इज फार्माकोलॉजी बेस्ड, कि एक पेशेंट है जिसको ट्यूबरकुलर मेनिंजाइटिस है और उसके सीटी स्कैन में पहले मैंने प्लेन सीटी किया तो हाइड्रोसेफलस आ रहा था, फिर मैंने कॉन्ट्रास्ट एनहांस सीटी किया तो साथ में बेसोजेनिक सेरिब्रल एडीमा भी आ रहा है। तो क्विकली कमेंट इन द चैट बॉक्स व्हाट ड्रग वुड बी यूजफुल फॉर मैनेजमेंट ऑफ बेसोजेनिक सेरिब्रल एडीमा। ऑप्शंस हो गए आपके असीटाजोलामाइड, मैनिटॉल, ग्लिसरॉल और डेक्सामेथासोन। सो कैन आई हैव क्विक आंसर्स देयर, वोटिंग कर लेते हैं। बिकॉज पीवाईटी की बात हो रही थी तो आई थॉट आई शुड लाइक जस्ट टेस्ट योर बैकग्राउंड knowledge. And okay, I am having quick answer coming in there for vasogenic cerebral edema. Okay, we had a second input there. Cool. Let's just see. Absolutely. Now, guys are getting a hint there that we do not use mannitol for vasogenic cerebral edema. It is steroids that would be useful. It is Dexona that would be present. So I just changed my tone of voice there in the end actually to help you out. But I think you guys should be knowing that cerebral edema दो प्रकार का होता है ना, तो ये सिर्फ FMG solution में दिया हुआ है कि एक साइटोटॉक्सिक cerebral edema होता है और एक वेसोजेनिक cerebral edema होता है, एंड दोनों का जो ट्रीटमेंट है इट्स नॉट गोना बी द सेम. सो cerebral edema is the PYT that we are talking about, and if he gives you cytotoxic cerebral edema तब आप आंसर करोगे mannitol, and if he gives you vasogenic cerebral edema then you are gonna be answering it as dexamethasone. So that's the basic point that you need to basically understand कि वो cerebral edema तो वही रहेगा ना यार, disease is not gonna change. No, we are gonna have the same patients with same kind of symptomatology, but then the answers in the question would change in a similar fashion. So I had good answers there. Wool, let's move on to the subsequent slide.
please switch to next slide. The question is it advisable to start the clinical based question from the FMG solution directly? And how can we effectively approach them without extensive prior subject knowledge? Sir, over to you. I think you'll be the right person. बच्चा बोल रहा है कि बिना पढ़े कैसे क्वेश्चन सॉल्व करें?
वो तो नहीं हो सकता भाई. Clinical based questions cannot be solved just like that. I think देखो best तो यही है, if you are in third year, fourth year, respective of whichever country you are studying, if you will go into any college, there would always be some teachers, some professors who would be more than happy, in spite of the language barrier, to show you the case. To pick up a clinical finding of bridge deep tendon reflex or Babinski sign, you don't need language. Patient will not say, I have Babinski sign. Patient is not going to tell you that I have a loud S1. So you need to get the hang of going with a stethoscope to honor that stethoscope. Now, when you go into a ward, भाषा नहीं भी आती तो फर्क नहीं पड़ता. तो I think first you need to do a, like मंदिर में परिक्रमा करते हैं ना, वैसे ही like it's like you need to do all the 19 subjects thoroughly. And once you do one चक्कर of all of them, then attempt those clinical based questions instead of trying to beat around the bush, को समझ में नहीं आएगा. Right? मैं एग्जाम्पल बोल रहा हूँ कि मैं सपोज चलो आप लोग कमेंट करना क्विकली चैट बॉक्स में, कैम्पेलोबैक्टर जजनाई के लिए जो सिलेक्टिव मीडिया होता है वो कमेंट कर देना. Comment on the selective media for Campylobacter jejuni. And Campylobacter jejuni is one of the leading causes of food poisoning in India. You're lots of time in India in restaurants, right? वो तो नमक डालते हैं, right? Dal has so much of salt, sabji has so much of salt. Why they put so much of salt is to decrease the growth of the bacteria, right? Because Campylobacter jejuni otherwise would grow and would contribute to development of food poisoning. So okay, so I had one good answer, Mueller-Hinton. I had chocolate agar coming up. No, guys, Mueller-Hinton is one of the media, but it is not the selective media. The selective media for Campylobacter jejuni is going to be Skiros media. Check it out in your notes. Madam has told that very, very beautifully. It is Skiros media which is to be used. So he can give you a case of a food poisoning, or he can give you a case of Guillain-Barré syndrome, because in about 10% of cases of GBS, Campylobacter jejuni is a offending agent. So there have been a question in the past where he has said, like, for the offending agent, what culture media would be used? So my suggestion, the answer to your question is कि जैसे परिक्रमा करते हैं like that, right? So you need to do all the 19 subjects once. The basic idea होता है. This is not biology exam थी. बायोलॉजी में तो बॉटनी जोलॉजी होती है ना, उसमें तो फ्लोएम होता है, जाइलम होता है, प्लांट में पत्ते का क्या पूछेगा? तो पत्ते के स्पेसिफिक आंसर होते हैं. तो दिस इज नॉट अ नीट यूजी एग्जाम वेयर लाइक बायोलॉजी टीचर विल टेल यू 10 पॉइंट्स एंड यू गेट 6 पॉइंट्स करेक्ट. यू बोला हाँ जी बायोलॉजी आ गई. भाई दिस इज मेडिकल साइंस राइट, देयर कैन बी 10 टाइप्स ऑफ डिफरेंशियल डायग्नोसिस ऑफ अ सेम पेशेंट। तो हम स्पेसिफिक आंसर की बात नहीं कर रहे हैं, हम एनालिटिकल कैपेबिलिटी की बात कर रहे हैं, हम स्पॉट ऑन आंसर की बात कर रहे हैं। मैंने जैसे ही बोला कैम्पेलोबैक्टर जजनाई योर ब्रेन शुड बी स्पॉट ऑन मैन, ये इनएक्सक्यूजेबल है। आप माइक्रो पढ़े हैं, स्क्लेरोज मीडिया समथिंग दैट हैज टू कम स्पॉट ऑन। तो आप क्या करना आज कि लाइक यू नो जस्ट हिंट इन केस यू वांट फॉलो इट, write down the name of all the bacteria and write down the selective media for each one of them. If you're not going to do that in your own handwriting, believe me, जब वो सवाल पूछेगा, you're gonna be like, you know, Muller Hinton will be in the options and Skiros media will also be in the options and you're gonna be like, okay, fine, ये भी था, सब confusing हो गया पेपर. But when you write it in your own handwriting, that would be the best way forward. So I've given two answers here. First, complete all the 19 subjects, and second, once you've done that, then start writing down the data, analyze it, and I think you'll be able to do it relatively better. Okay.
राइट राइट। और आई थिंक उसी के बाद से, पढ़ने के बाद से ये क्लिनिकल करने में मजा आ जाएगा। अदरवाइज क्लिनिकल तो ऐसा लगेगा कि आप रट रहे हो, जैसे बाकी सारी वन लाइनर्स रट रहे हो, तो ये रटने जैसी बात हो गई कि यू आर जस्ट स्टडिंग द सेम थिंग एंड यू आर जस्ट ट्राइंग टू मग अप द आंसर, सो दैट वोंट सॉल्व द पर्पस, राइट? वी कैन गो टू द नेक्स्ट क्वेश्चन प्लीज। How should we manage our time and prioritize topics using FMG solution, particularly with the focus of PYQs? I think इस सवाल का जवाब हम 2-3 बार दे चुके हैं कि उसको मैनेज करने के लिए
I
थियरी
think
के
all
साथ
the
इंटीग्रेट
topics
करिए।
that are given in the book have to be gone through.
Yes.
I think one reading of the book is not a big deal. I'm asking you to. I mean, you guys are such brilliant people. Crunching 1,500 pages. I mean, you can just gobble them up, right? 50 pages every day. 30 days, you can finish 1,500 pages. What is 1,500 pages for you guys? I mean, no big deal, right? So if you dedicate like, you know, 50 pages every day, तो ज़्यादा तो नहीं है यार. I mean, you attend classes, you come back and then just go through the pages fast. You just have to read the data once. So fast reading is the step forward. And I'm not saying that on the first day you will do 50 pages. On first day, 1 page will be done. Second day, 2 pages will be done. Then gradually you will build up stamina, and like a train, no, like a locomotive, when it starts rolling out of a station, it does not start going at 200 kilometers an hour immediately. No, you have to build up your momentum and gradually you have to build it up. So I think that if you are, you will be having shortage of time, cut down on sleep time, man. I mean, I'm not saying that don't sleep at all, but then cut down on sleep time, cut down on Instagram time, and I think you'll have all the time in the world to do this activity. I find it absolutely no reason why 1500 page cannot be read in like 1 month period. And it's a do, it's like karna hai, like I have to do it, man. And you are brilliant chaps, you are very much capable of that. I am trying to help you realize the beast in you. I'm trying to help you realize that monster in you who can gobble up all those subjects, and like a champion, you guys are gonna be able to crack and clear the exam in the very go. So it's just that I have to tell you the hidden talent that you have. So go for it, man. Go for it. And
Right.
I think time की बात वो लोग करते हैं जो इनके पास मतलब ऐसे, I will not say like you are wrong in asking this question, but then it is like you know, I don't want my students to be finding an excuse. I want my students to be like, you man, we're gonna do it. Sir, आप बोल दिए you want us to sleep? I said, yeah, I want you to sleep 6 hours a day. You want us to study 18 hours a day? Yeah, I want you to, but 18 is not possible. So try to do at least 10, at least try to do 12. If you do that consistently, it's more than sufficient. 2 months, you are gonna be in a position to at least analyze, right? All the information in your brain. And I think that's the way forward.
And one more thing that I would like to add here, sir, if you want to really cut short this entire duration, there is one more way. Because 1500 पेजेस 1600 पेजेस जो भी दिया हुआ है उसमें देखोगे तो एक्चुअल में जो आपको सॉल्व करने वाली जो चीजें, जो एक्सप्लेनेशन पढ़ने वाली हैं, वो बहुत ही कम होगा। क्यों? बिकॉज इफ यू नो द वाई बिहाइंड अ क्वेश्चन, फॉर एग्जांपल लेट्स से एक क्वेश्चन आया, जैसे सर ने अभी पूछा कल्चर मीडिया के बारे में, या मैंने जो पूछा अल्कोहल वाला एग्जाम्पल के साथ, इफ यू नो द वाई बिहाइंड द क्वेश्चन, अगर आपको पता है कि इस क्वेश्चन का आंसर क्या है और क्यों वही आंसर है और अदर नहीं है, then you don't need to spend much time on reading the entire explanation. You don't need to. In that case scenario, what you can read is the boxes. जो समझदार बच्चे होते हैं वो क्या करते हैं, एक्सप्लेनेशन के लास्ट में एक बॉक्स दिया रहता है, एक्स्ट्रा माइल बॉक्स, ऑल्सो नो बॉक्स। जो आपके आने वाले क्वेश्चन, अगले एग्जाम के क्वेश्चन पॉसिबली होते हैं, वो उस बॉक्सेस से होते हैं। क्यों? बिकॉज उन बॉक्सेस में दूसरे ऑप्शन के एक्सप्लेनेशन छुपे होते हैं। वी हैव एक्सप्लेनेशन ऑफ अदर ऑप्शन इन दोज बॉक्सेस, because we always say that previous year topics are important. So two things that I said, one is try not to spend much of the time because you do not have much time. Let's say we have 60 days left. So try not to spend much time on reading explanation. if you already know the reason behind the answer that you have given, and try to spend just some time on the also know and extra mile boxes. You can take the next one. How can FMG solution book be effectively used to prepare not just for FMG but also for NEET PG? मैं आपको एक फैक्ट बता रहा हूँ कि FMG solution जो है, जस्ट मैं बता रहा हूँ, जो सेल है वो 70% सेल FMG स्टूडेंट्स के लिए है और 30% सेल, अकॉर्डिंग टू आवर डेटा दैट वी फाउंड आउट, 30% सेल was 25 to 30% on an average. It has been among the NEET PG aspirants. Do you know why? Because पिछले एग्जामिनेशन उठा लीजिए, उसका पिछला एग्जामिनेशन उठा लीजिए, we will see that 70-80 क्वेश्चन मैं पिन पॉइंट कर दूंगा, हाँ ये क्वेश्चन यहाँ से आता, नीट पीजी में भी ऑलमोस्ट सेम टॉपिक होते हैं. मैंने ये नहीं कहा कि सेम क्वेश्चन आ जाते हैं, सेम टॉपिक होता है. जैसे मेथनॉल का हो गया, एपिलेप्सी का हो गया, या हार्ट का जो सिचुएशन है, हार्ट फेलियर का टॉपिक हो गया, हाइपरटेंशन का हो गया, जो आपका टॉपिक है वही उनका भी टॉपिक है. तो कैन यू यूटिलाइज दिस? डेफिनेटली यस, अ बिग यस. अ लॉट ऑफ स्टूडेंट्स आर यूजिंग इट, so definitely you can utilize in future examination as well. Sir, you were saying something.
I'll put up a question to these guys again. Which drug in diabetes will increase cardiovascular mortality? Drugs in diabetes that will increase cardiovascular mortality. They're asking about, like, how do we upgrade? So instead of asking what drugs will reduce cardiovascular mortality, I'm asking which drug will increase cardiovascular mortality. So those who are saying only major topics would be covered. Only major topics are the core aspects. Diabetes is a core aspect. SGLT2 inhibitors will reduce cardiovascular mortality. Guys, listen to the question carefully.
Increase.
Most people are answering about those drugs which are going to be lowering cardiovascular mortality. I asked about drug which will worsen cardiovascular mortality. And the correct answer for that would be thiazolidine. So molecules like pioglitazone, rosiglitazone, they tend to worsen or increase cardiovascular mortality. Drugs that are going to be lowering cardiovascular mortality are like GLP-1 receptor agonist or going to be SGLT2 inhibitors, as were mentioned. No, guys, most answers were slightly off the track. Read anti-diabetic drugs very thoroughly. At least make 2 pages of notes. Read diabetes from both pharmacology questions as well as diabetes and medicine questions. And drugs asked in anti-diabetic management are going to be the core issues. One more question for you guys before we take up a next question. A diabetic has been identified recently. His HbA1c is 11%. Type 2 diabetes. What is the first drug to be started? Options are going to be like metformin, glipizide, insulin, and acarbose. Metformin, glipizide, insulin, and then one more, anything, acarbose that can be introduced, like type 2 diabetes and HbA1c is 11%. So we are having a mixed response in this case. Those who have listened to the video would be very much familiar. And even in the book, we have highlighted this very categorically. Anybody having HbA1c more than 10%, we are going to start with insulin and we are not going to start with metformin. Routinely type 2 with HbA1c between 8 to 10%, it's going to be like metformin. Otherwise, it's insulin that should be started. So those are like very simple, straightforward questions that are put up before you. So these are like bread and butter for you. They have to be just finished up. They have to be get correct in the first 15 seconds only. You get 1 minute in a question. So try to do as many questions as possible from the book itself. And I think if you're sorted like medicine, if you do 600 plus questions, you are more than, that is more than enough, right? You don't have time much more beyond that. I want you to do 6,000 questions in general medicine. I want you to do 10,000 questions in surgery so that you are expert of everything. But then it's practically humanly not possible. So we have hand filtered those 600 for you. So I think if you use them effectively, you would be on right track. बाकी आप समझदार हैं and like you would be the best judge.
राइट सर. सर जो टॉपिक अभी आप क्वेश्चन अभी जो पूछ रहे थे, सेम टॉपिक नीट पीजी में भी आया हुआ है. कैसे? विच ऑफ द फॉलोइंग ड्रग इंक्रीजेस द यूटीआई? वही क्वेश्चन एफएमजी में आया. विच ऑफ द फॉलोइंग ड्रग इंक्रीजेस द रिस्क ऑफ वल्वोवेजाइटिस? दोनों का आंसर सेम था, SGLT2, राइट. और कार्डियक मोर्टालिटी, बहुत सारे बच्चे करते क्या हैं जो एग्जाम में, दे आर नॉट दे आर नॉट, इट्स नॉट लाइक दे डोंट नो द आंसर, दे आर मेकिंग सिली मिस्टेक. जैसे आपने जब भी पूछा कि which drug increasing the mortality, many of them started marking empagliflozin because वो mortality को empagliflozin के साथ ऐड कर लिए. They are not reading increasing या decreasing. तो इस चीज को थोड़ा आप लोग अवॉइड करिए कि जल्दीबाजी में मत रहिए. Read the question carefully and then mark it. That is another way to improvise your score. We can take the next one. Can we have the next question, please? Okay. For repeaters, what strategy can they implement using FMG solution to enhance their understanding? For repeaters, I would strongly say कि अगर आपने नहीं किया है तो एक काफी बड़ी गलती करते आ रहे हो अभी तक. Start looking onto the question that has been asked. Read their explanation very carefully and try to improvise your basics. अगर रिपीटर हैं, कई बार के रिपीटर हो चुके हैं, तो मतलब मैं ये बोलूंगा एनाट, फिजियो, बायोकेम, पैथो, फार्मा, माइक्रो और फोरेंसिक, ये जो आपके बेसिक सब्जेक्ट हैं, इनको स्ट्रॉन्ग करना बहुत ही ज्यादा जरूरी है. वर्क ऑन दैट एंड दैट इज गोइंग टू हेल्प यू आउट डेफिनेटली इन योर स्कोर्स. And make sure that you are integrating your notes with the book. Saying just solving PYQs or saying just doing the notes will not help. It should always be a combination between the both.
But you can do that, no? Like you read a topic from a book, you solved an MCQ, you find a point, add it to your notes, make your notes
That's
more
it.
complete, no? So
That's
keep on making those stick-on points and keep on adding those stick-on points. And there is no difference in additions as came up in the chart. So don't worry about like if you have an old edition, new edition, no point of changing the edition at the last moment. You will
Right.
lose the visual memory of whatever you have learned already. As far as the going through the new questions are concerned, they are available on my YouTube channel. They are available on Sir's YouTube channel. So I think don't bother about the addition part. Just get through, just as I said in the beginning, by paper 1 में 100 number ले आओ यार, तो बाकी कुछ भी हो जाएगा. That doesn't really matter, right? Paper 2 you'll be still getting like 65, 70. So you are in safe zone of 170. No, so why take so much of stress? But then make up those basic subjects very strong. Like if you say honestly that you're giving us paper second time, paper 1 was easy last time, then my question is only one. If you say paper 1 was easy, then why get 85 or 90 marks in it? You just have to push by, make it 100. No, if you make 100 marks in paper 1, there is no power in the world that can ever stop you. That's finished. I mean, that is the stamp, that stamp of authority that you need to put कि पहले उसमें इनिंग में मैच जीत लिया. I think that is the main mantra. That's the main focus that we have tried to give in the book. That's what we try to highlight per se. Those initial questions you will see, they are very high yield. You just keep on adding those points to your notes. Make your notes more
Right.
potent. I think that's the way forward.
बिल्कुल. Next one, please. All right, so these are just some of the important examples. I think जितने क्वेश्चन थे हमने सारे क्वेश्चन को आंसर कर दिया सर. These are just to show you guys that how questions are being asked actually. अगर इसको जूम करेंगे फैजान, अगर आप इसको जूम करेंगे तो यू विल रियलाइज कि क्वेश्चन आते कैसे हैं और किस तरह से ये बुक में इंटीग्रेटेड है. सेम क्वेश्चन, सेम इमेज, सेम तरीके से क्वेश्चन आए हुए हैं. यू कैन जस्ट गो अहेड. और ये जो पीडीएफ है इसको हम टेलीग्राम ग्रुप में और इसका लिंक भी शेयर कर देंगे आपको, फ्रॉम वेयर यू कैन डाउनलोड एंड यू विल सी कि अभी जो रिसेंट एग्जामिनेशन हुआ था उसमें से 140 प्लस, ये मैं नहीं बोल रहा हूँ, ये आपके सीनियर्स ने बोला है कि सर ये क्वेश्चन आया और उन्होंने ये मार्क किया हुआ है कि ये क्वेश्चन इस पेज नंबर से आया हुआ है. So you can download the PDF and you can check it out ki how important it is for you to read the previous year topics. We can go ahead and I think we can just start the lucky draw and after that we will end the session. और अगर किसी का और query रहेगा तो we will take those query. Please, Faizan.
Yes, sir.
Please facilitate the lucky draw.
Yes, sir.
This lucky draw will be for the students. जो भी मतलब स्टूडेंट जिन्होंने फॉर्म भरा है, अगर वो क्लास में अभी अटेंड कर रहे हैं तो they will be getting author's signed copy. It will be sent to you anywhere in India. इंडिया का जो भी एड्रेस दोगे वहाँ पे it will be shared to you. And if you are in Delhi, then it will be much easier for us and you as well. Sir, we have taken all the questions. जितने भी क्वेश्चन आए थे हमारे पास, we have taken all the questions from the student.
Cool. So I need to rush actually, so I'll exit the meeting and you guys can continue.
All right, sir. ठीक है. Thank you. I think we are done.
Thank you.
Thank you very much. We'll just do this lucky draw, and then
Right.
after that we will end the session also.
जी. Okay.
ठीक है, sir.
Thank you, sir.
थैंक यू वेरी
Thank
मच
you.
सर, थैंक
Thank
यू
you.
सर। देखिए जून 2025 में अगर एग्जाम देना है तो आई वुड स्ट्रांगली से कि आप किसी किसी सब्जेक्ट में जो बहुत ही बड़ा है उसका रैपिड रिवीजन से कर लो, बाकी मेजोरिटी ऑफ द चीजें तो आपको मेन नोट से ही करना चाहिए। मेन नोट्स इज समथिंग दैट आई वुड स्ट्रांगली रिकमेंड। Okay, we have Manjunath. Bluntly speaking, sir, I have studied physio in second year MBBS, then didn't do it. I'm not blank for it. Other subjects have physio too. But if I have to do physio now, can I use the same retrospective way? Yes, you can do, but उससे बेहतर ये है कि जो सेकंड फर्स्ट ईयर में आपने जो भी पढ़ा या सेकंड ईयर जो भी पढ़ा, उसका सोर्स जो है उसको मत छोड़िएगा। अगर आपने अपने जो मेडिकल कॉलेज वाला लेक्चर से किया है तो डेफिनेटली आप उसको रिवाइज करने की कोशिश करिए। अगर वो नहीं तो आई वुड स्ट्रांगली से कि जो भी आप प्लेटफॉर्म यूज कर रहे हो ऑनलाइन, फॉर एग्जांपल अगर आप प्रेपलेटर यूज कर रहे हो, पीडब्ल्यू मेडेड यूज कर रहे हो, जो भी प्लेटफॉर्म यूज कर रहे हो, एटलीस्ट उस प्लेटफॉर्म के जो भी कंटेंट है उसी को रिवाइज करिए। आई वुड स्ट्रांगली से सेवेंथ एडिशन तो काफी ओल्ड हो गया बच्चे। आई वुड स्ट्रांगली से अगर आप एग्जाम देने जा रहे हो, एट्थ इज समथिंग दैट वी कैन सेटल। इट्स जस्ट दैट वी हैव टू फाइंड आउट कि जो दो नए पेपर हुए हैं उनको हमें सॉल्व करना है। सेवेंथ एडिशन इज क्वाइट ओल्ड, तो आई थिंक यू कैन स्विच टू नाइन्थ ऑलरेडी। सेवेंथ के बाद तो काफी चेंजेस हो गए हैं। एट्थ एडिशन है तो कंटिन्यू करिए। डिफरेंस क्या है, एट्थ और नाइन्थ में दो पेपर ऐड हुए हैं, जून 2024 जुलाई 2024। जो एरर्स थे, जो रिकॉल में थोड़े बायस थे, उस रिकॉल बायस को हटाया गया है अलग अलग जगह से। बुक में जो टू मच रिपीटेशन थे उसको कम किया गया है, और बुक में जो है कि जहां कहीं भी क्वेश्चन बार बार रिपीट हो रहे थे, टू मेनी इमेजेस रिपीट हो रहे थे, उनको कम किया गया है। तो ओवरऑल बुक का बल्क भी कम हो गया है। अगर आप देखोगे बुक का साइज भी काफी कम हो गया है। Yes, if you have already completed rapid revision, definitely you can and you should, है ना, and definitely you try to finish it और make sure कि जितने भी important table और boxes दिए गए हैं उसको आपने पूरा कर लिया है। Yes, Faizan, can you explain how are you going to do this and how are you going to select the winners?
Uh, yes, sir. Thank you, sir. So we have already 577 responders, those who have filled the Google form, and
Right.
they are the ones who will be eligible for this lucky draw.
तो अगर वो क्लास में अवेलेबल है, इसमें अवेलेबल है, because many of the students they could not get entry because we had limitation of only 100. तो उनको कैसे देखेंगे अगर YouTube में अगर वो कमेंट करना चाहें, या कैसे उनको हम सिलेक्ट करेंगे?
No. It just Google will be showing a random number.
Okay.
Let's suppose the max participants are 577 here.
Okay.
Let's suppose if 360 comes.
Okay.
So whoever is there in the Google form list, whoever
ठीक
is
है,
there in the number of 360,
ठीक है,
that will be the lucky person to
ठीक है।
get.
तो ऐसा करिए, इसको आप 3 बार कर लीजिएगा, बिकॉज
Okay.
ऐसा हो सकता है कि जिस फर्स्ट पर्सन अगर रेस्पॉन्ड नहीं करता है आपके मेल का, तो वी विल गिव टू सेकंड वन, अगर सेकंड भी नहीं करता तो विल गिव टू द थर्ड वन।
Okay.
सो ऑर्डर में कर लीजिए 1 2 3। और बीच में आई थिंक एक क्वेरी आया है, मैं उसको आंसर कर दे रहा हूँ। फार्मा और माइक्रो के लिए देखिए, फार्मा तो वन ऑफ द मोस्ट इंपॉर्टेंट सब्जेक्ट फॉर योर मेडिकल कैरियर, मैं बार बार बोलता हूँ। अगर आप एग्जामिनेशन अभी देने वाले हो तो रैपिड रिवीजन नोट्स, मतलब अगर आप दिसंबर या जनवरी में देने वाले हो तो डू द रैपिड रिवीजन नोट्स। इफ यू हैव टाइम, इफ यू आर वन ऑफ द जून आई मीन 2025 एस्पिरेंट, स्टार्ट डूइंग फार्मा दैट आई हैव टॉट ऑन द प्लेटफॉर्म और इन ऑफलाइन क्लासेस। जहाँ कहीं से भी आपको फार्मा का नोट्स मिल जाए, आप उस फार्मा के नोट्स को करिए। अगर आपको लाइव लेक्चर मिल जाए तो उससे बेहतर कुछ है नहीं। ठीक है। जुलाई 25 को एफएमजी देना है, बिल्कुल आप मेन वीडियोस करें, आपके लिए तो मेन वीडियोस ही काफी बेहतर है। वी हैव गुड टाइम। देखिए नीट जितनी भी बातें मैंने अभी तक बोली हैं, सर ने बोली हैं, वो सारी बातें नीट पीजी के लिए भी एप्लीकेबल होती हैं। आप देखोगे नीट पीजी और एफएमजी में सिर्फ नाम का फर्क है और ज्यादा कुछ फर्क नहीं है। ठीक है, यू कैन नॉट स्किप। इफ यू आस्क मी कैन आई स्किप साइकेट्री और कैन आई स्किप रेडियोलॉजी, नो यू कैन नॉट स्किप एनी ऑफ दिस। 19 मतलब 19, नॉट 18, नॉट 20, 19 मतलब 19, ये सवाल ही गलत है ना, इनवैलिड सवाल है ना। आप 19 को 19 में से कोई स्किप नहीं कर सकते, वो तो हम कभी रिकमेंड नहीं करेंगे। मिनिमम आप अगर नहीं कर पाए हो तो मिनिमम ये कर सकते हो कि एटलीस्ट एफएमजी सॉल्यूशन में जितना कंटेंट दिया हुआ है एटलीस्ट उसको एक बार ब्रशअप कर लो अच्छे से, बट छोड़ के तो कुछ नहीं जाना है। मैंने इस सवाल का जवाब ऑलरेडी दे दिया है। 8th और 9th का जो डिफरेंस क्या है, वी हैव ऑलरेडी गिवन द आंसर टू दिस क्वेश्चन की 2 पेपर ऐड हुए हैं, एरर्स को निकाला गया, रिपीट क्वेश्चंस को हटाए गए हैं और बुक के बल्क को थोड़ा कम किया गया है। जो एलएमआर क्वेश्चन था उसको हमने एलएमआर वाली बुक के साथ ही, मेन बुक के साथ ही क्लब कर दिया है। यस फैजान, प्लीज प्रोसीड।
Yes, sir. Thank you, sir.
So we are proceeding with the lucky draw and let's see who comes, who gets the lucky number, and they will be the one to get the book from our side.
Okay, sir. So we got 200 as the lucky number, sir.
कहाँ दिख रहा है, मतलब मुझे तो नहीं दिख रहा है।
This at the left side, sir.
अच्छा, हाँ हाँ, आंसर 200।
Answer.
ऑल
Yeah.
राइट, आई होप 200 नंबर पे कौन है, आप हम देख पाएंगे क्या?
Yeah, sure, sir.
चलिए आप ऐसा करिए, पहले ये 200 नंबर लिख लीजिए
Oh,
एंड देन वील ट्राई, दो बार और कर लीजिए, देन आई विल आल्सो लीव बिकॉज here there is lot of rush that is going on and then we can actually talk to these students and आप लिख लीजिए कि हमारे लिस्ट में 200 नंबर पे कौन है जो 200 फॉर्म भरा है। प्लीज स्टार्ट द सेकेंड वन। फैजान, प्लीज स्टार्ट द सेकेंड राउंड।
sir. This time it's 128, sir.
ओके, प्लीज टेक द थर्ड राउंड।
Sir, this time it's 377.
Okay, so we have three, and the one person, first one you will try. Our team will get in touch with 200 or जो भी तीन नंबर है, whoever responds, I mean in order, we will be sending this to all these students. I hope that this session was useful for all of you guys and we were able to answer all your queries. जो भी query आपके रह गए हैं, अगर query कुछ बाकी रह जाती है तो आई थिंक फैजान आप शो कर सकते हैं पावर पॉइंट का लास्ट स्लाइड, जिसमें टेलीग्राम ग्रुप का एक्सेस भी है और इंस्टा का लिंक एक्सेस भी है। आप उसका स्क्रीनशॉट ले सकते हैं एंड यू कैन डाउनलोड द पीडीएफ फ्रॉम देयर, और कुछ भी अगर क्वेरी है तो आप वहाँ पे भी रीच आउट कर सकते हैं। कैन यू शेयर द लास्ट पीपीटी पेज?
Yes, sir. Sure.
मैं मैसेज में भी डाल दे रहा हूँ। इसके बाद एक और होगा, ये वही वाला है जो मैंने आपको भेजा था। ये मैंने आपको जो भेजा था वो नहीं है।
Yes, sir. That is the same one. Mukesh sir is sharing his screen, sir.
ओके ओके, ठीक है, मैंने ग्रुप इसमें मैसेज में डाल दिया है। नहीं, ये वो वाला नहीं जो मैंने भेजा था। एनीवे मैंने मैसेज चैट बॉक्स में अपने दोनों लिंक्स डाल दिए हैं आप सब लोगों को, आप उससे चैट बॉक्स से आप उसको ले सकते हैं एंड we'll just upload it there, and I hope this session was useful to all of you guys. Thank you very much, and I hope to see you around, all of you. Thank you, Faizan, for facilitating everything. Dr. Faizan is one of the student who has been our student, and he has recently passed FMG examination, and he's doing wonders. He is one of the most brilliant chap that I have come across, and I'm very sure that he's going to do good in upcoming days. Thank you very much to all of you guys. I will see you guys.
Thank you so much, sir.
Ciao. Bye bye.
I think, guys, you can stay if you want to know who is the winner.